John F. Barnes' myofascial release approach is an important, safe, and highly effective therapy for the reduction of pain, headaches, and restoration of function. Myofascial release is a fusion of ancient wisdom and recently discovered scientific insights. When we look at living fascia, it appears as clear water-filled microtubules and sealed elastic compartments. These structures allow forces that come through the body to be distributed to the whole system, preventing large forces from injuring individual parts of the body. In healthy fascia, these freely glide past each other without restriction. Since the fascial system surrounds and infuses every cell in your body, restrictions in one area can have an effect far away from the site of injury, making diagnosis difficult. The fascial system is a whole body system that interfaces and infuses every other system and cell of your body. Trauma, inflammation, and surgery can cause myofascial restrictions that can ultimately cause crushing pressure upon pain-sensitive structures. This pressure can be up to 2,000 pounds per square inch. When we have restrictions in the fascia, it behaves much like a sweater where a restriction in one area can affect the entire system, causing symptoms far away from the original trauma. The compressive forces from these restrictions can create pain from compression to the nerves or joints. They can also restrict blood flow, causing swelling and altering cellular functions in many areas of the body, creating disease. It is important to note that myofascial restrictions do not show up in any of our medical tests that are currently utilized. Tests like X-rays, MRIs, CAT scans, and blood work will not show myofascial restrictions. To understand how myofascial release works, we need to show the properties of fascia. There are a number of influences on the fascial system provided by water within the microtubules and the self-assembling nature of these tubules influenced by the direction of force within the fascial system. In this clip, you can see the microtubules glide, divide, and stretch along with water moving through the microtubules. The water in the fascia is in liquid crystal form because fascia is a hydrophilic protein or water-loving tissue. According to research carried out by Dr. Gerald Pollack at the University of Washington, water within tubules of hydrophilic material will form a liquid crystal layer of purified water on the inner surface, create an electrical charge, and cause the water in the center to flow. This is driven by light energy, particularly infrared energy, released when crystalline structures are compressed. This effect peaks at 5 minutes and can sustain for hours. It is believed that this effect is what pressurizes the fluid within the compartments and microtubules of the fascia and helps to push blood through the small capillaries of the body. Doctors have recently reported finding a new organ while using a confocal laser endomicroscope to look at the cells of a patient's bile duct. This microscope allowed a real-time image of living cells that allowed the doctors to see the delicate microtubular network of the fascial system at the microscopic level of the individual cell. Before this discovery, it was assumed that the cells of the body were connected cell wall to cell wall by a solid collagenous tissue. Instead, they observed the fluid-filled tubular network which drained into the lymphatic system of the body, providing shock absorption, nutrient flow, and communication between the cells of the body. You may notice that this microtubular network is organized in much the same way we see the fascial network at larger magnifications. In this time-lapse confocal microscopic movie, we can see flow through the microtubular network of an individual cell. This demonstrates that even the cellular cytoskeleton is made of fascial structures composed of fluid-filled microtubules. Another benefit of sustained moderate pressure was discovered by Dr. Paul Standley. He has done research on the effects of sustained moderate pressure on bioengineered fascia. He found that after 3 minutes, the tissue produced interleukins, a crystalline protein that helps activate anti-inflammatory processes in the body. He also noted that if you strain the fascia too hard, you can decrease the effectiveness. This is another reason, besides fascia's 2,000 pound per square inch tensile strength, a John Barnes trained myofascial release therapist doesn't force the tissue, but sustains moderate pressure until the fascia begins to soften on its own. When a therapist applies myofascial release, they will slowly sink into the skin and then apply a shearing force without sliding on the skin to place a moderate strain in the direction of restricted movement. They can apply a counter strain with the other hand. This uses the skin as a handle that reaches deep into the body through the fascial connections between all the structures in the body. The therapist can tell, through feeling tension in the skin, the underlying areas of restriction. The therapist adapts the direction of the shearing force as the tissues below release in a multitude of directions. It is a therapeutic art that requires sensitivity and adaptability, much like playing an instrument. We are just beginning to understand the complex functions of the fascial system. I hope this short video has provided you with a deeper understanding of myofascial release and inspires you to seek out myofascial release to enhance the quality of your life.